Hare Krishna. So today we are going to talk all about diabetes. What is diabetes? How does it occur? Types of diabetes, common symptoms, management and its complications. What is diabetes? It is a chronic health condition which is characterized by high blood sugar levels, either due to reduced insulin production or reduced insulin function. How does it occur? When we eat carbohydrates, carbs, these carbs break down into glucose. Glucose is released into bloodstream. Glucose is transported from our blood to the various cells of our body. In cells, glucose is broken down to produce energy for the body organs to perform various functions. Now this transport of glucose from bloodstream to the cells of our body is done by a hormone called insulin, which is produced by pancreas. If by any case insulin production or function is hampered, so blood sugar level increases, resulting in diabetes. There are two types of diabetes, type 1 and type 2. Type 2 generally occurs in 10% of individuals, whereas type 2 occurs in 90% of individuals. Type 1 is non-reversible, type 2 is reversible. In type 1, insulin production is hampered due to improper functioning of pancreas. That can occur either due to some infection in pancreas, some autoimmune disorder, some tumor, or maybe some genetic issue. And in type 2, the insulin function is hampered, which mostly occurs due to some lifestyle choice. Now let's see all about type 2 diabetes. 5 major reasons of type 2 diabetes. Number 1, obesity. Number 2, excessive carb intake. Number 3, physical inactivity. Number 4, stress or anxiety. Number 5, improper sleep. All these things, they result in either insulin resistance or pancreas exhaustion. Now let's see how does it happen. People who eat excessive carbs or who do less physical activity or who are obese, there will be more glucose in their bloodstream as there is less requirement by the cells. So, there will be more insulin production by pancreas for the transport of insulin from blood to cells. So, there will be overload on cells with glucose. Thus, after a period of time, cells would stop accepting excess of glucose, thus resulting in increased blood sugar level. To balance the spiked blood sugar level, pancreas produces more and more insulin. This results in two things: more and more insulin resistance. Second, pancreas exhaustion. As pancreas get exhausted by producing excessive insulin for a long period of time, thus there will be impaired function of pancreas. The next reason is stress or anxiety. It raises a stress hormone called cortisol, which reduces the ability of cells to take up glucose from blood, thus increasing blood glucose levels. Same is with improper sleep. Cortisol will be released and it will be reducing the ability of cells to take up glucose, thus increasing blood sugar level. But there will be one more thing connected with improper sleep, that is inflammation in the body, which again hampers the uptake of glucose by cells, thus increasing blood sugar levels. There are some common symptoms related to diabetes. Number 1, increased thirst, frequent urination, fatigue, blurred vision, or weight loss. Now let's see how can we reverse or manage type 2 diabetes. Number 1, by taking balanced diet. Number 2, by substituting simple carbs with complex carbs. Number 3, intermittent fasting. Number 4, stress management. Number 5, proper sleep cycle. Number 6, regular exercise. Number 7, regular monitoring. Number 8, consumption of around 12 to 14 glasses of water every day. Now in balanced diet, I would like to suggest you all that we can take our carbs, proteins and fats in a balanced way, so that we can cut down on our carbs to reduce the sugar in our bloodstream. There are few important tips which I'm going to give you to manage your diabetes. Number one, empty stomach. You can have fresh lime juice with chia in lukewarm water. Secondly, you can have amla powder 1 teaspoon with pinch of turmeric powder in lukewarm water. Thirdly, you can add fenugreek seeds in your meals. Or maybe you can have fenugreek powder mixed with lukewarm water. Now second is substituting simple carbs with complex carbs. Simple carbs like sweets, candies, honey, refined carbs, all these are very harmful because they are going to produce excessive amount of glucose in our blood. But if we replace the simple carbs with complex carbs like whole grains, ragi, bajra, jowar, quinoa, veggies, legumes, fruits, nuts and seeds, then it is going to reduce the glucose in our blood. It is going to give us more fiber and they will be rich in vitamins and minerals. So here I'm going to give you a few other very important tips. Take smaller portion size at one time to reduce glucose levels at one particular time. Divide your plate in 4 portions. Your salads, your veggies, your proteins, your whole grains. To cut down on carbs, you reduce the glucose in your bloodstream. Reduce frequency of meals. At least give a gap of 4 hours before next meal. Because when we eat something, it takes around 2 to 3 hours to achieve the normal sugar level. So if we'll keep eating after every half an hour or 1 hour, then glucose level in blood would remain high always, resulting in insulin resistance over a period of time. So next is our intermittent fasting. Intermittent fasting, it reduces the inflammation in our body, thus activating our cells to take up the glucose from the bloodstream, thus reducing sugar level in blood. Next is stress anxiety management by meditation, yoga and all that. Next is managing sleep cycle. We must take 6 to 7 hours of sleep comfortably in a relaxed mode. So now next is regular exercise. If we become regular with our exercise, then there will be more energy consumption by the cells, thus decrease blood sugar levels. Then we can also opt for strength training. That can be of 2 types, either body weight training or weightlifting to increase the muscle mass, thus to increase the energy requirement, thus reducing blood sugar levels. This body weight training can be of many types like push-ups, squats or holding asanas for longer durations. So next is regular monitoring. Type 2 diabetes is generally asymptomatic. So I would advise above 30 years of age, there should be regular monitoring, which can be done by following 3 tests. HbA1c, fasting blood sugar level or post-meal blood sugar level. Then lastly, consumption of 12 to 14 glasses of lukewarm water. It gives us a feeling of fullness, thus reducing the portion size, thus reducing sugar in bloodstream. So now let's see what are the complications of diabetes. If we are not able to manage our blood sugar levels for a long period of time, then for sure we are going to land up into diabetes. And the various complications linked to it are heart diseases, kidney diseases, nerve disorders, eye damage, or even blindness can happen with it. There are various asanas which can help us to prevent diabetes or even they can reverse diabetes. So about that, we'll be talking in our next video. Until then, thank you. Hare Krishna.